I believe that surgery is a last resort for a number of reasons. Number one, the evidence shows that with many of the surgical procedures, it's hit and miss. You don't have predictable outcomes, and you're putting the patient through an expensive, risky procedure that may or may not work. There are some surgical procedures that are very predictable, but those are for patients that have really severe problems with their facial structure, not properly developed enough, where you need to have what's called orthognathic surgery, where you're breaking the jaw, moving everything forward to unencumber the airway. It's a serious surgery, but thankfully it is a predictable surgery done by the proper surgeon, done properly, that will extend the patient's life, health, and they'll benefit from. But that's also somewhat of a last resort if necessary, where you're weighing risks and benefits, but certainly that's an option. With a lot of the surgical procedures, you solve one problem, but you create other problems. For example, the UPPP, where they're removing the uvula and basically opening up the airway. It may mechanically open the airway, but at the same time, you're also removing a lot of the mechanoreceptors that communicate to the brain to tell you that the airway is closing down to begin with. So you're diminishing that patient's arousal response, and that oftentimes is not recognized. So surgeries are possible options, but they should be taken very seriously and weighted as far as the risk and benefit.